Hello, I'm Catherine Weatherburn, the founder of Safetyknot, and we work with construction companies and organisations who have construction elements in their projects, and we do this with the aim to promote safety and to prevent injury. In this video, we're going to discuss the consequences of injury, looking from the perspective of the construction company or the employer, and also from the perspective of the construction worker. We tend to work in low middle income countries, and this may be a different context from yours, but I believe that the principles shared in this video will also be relevant to you. So let's start by looking at injury in general from the perspective of the construction company, the organisation, or the employer. Well, according to the Health and Safety Executive in the UK, in 2022 to 2023, there were 45 fatalities in construction work. It's worth noting that there are fairly robust reporting mechanisms in the UK and also in other high-income countries, although it's also well documented that not all injuries, particularly more minor injuries, are not reported. However, in low middle-income countries, there tends to be less robust reporting mechanism. So it's worth noting that if you are looking at any national level construction injury data in these contexts, it's very likely that this is underreporting the number of construction-related injuries that are actually occurring. And in fact, it's widely recognised by injury prevention researchers that reported injuries in low middle income contexts are likely to underreport the actual rate of injuries occurring. And they often say that these figures are only the tip of the iceberg. Well, let's use the example. Let's say that a fatal injury occurs on site. Work will have to stop for this death to be investigated. And the process of this, of course, will look different in each context. But work should stop. Incident reports and other paperwork need to be completed. And this can all be extremely time consuming, as well as obviously the sad fact that someone has died on site. But this can have a knock-on effect of a consequence of a delay. This can also result in increasing project costs. And again, depending on the context, the company may have to pay compensation to the individual who's been injured, or if a fatality has occurred, to their relatives. But it's not just fatalities which can cause delays and increasing costs. The Lighthouse Construction Industry Charity, which is a UK-based charity, estimates that every year in the UK alone, more than 2.4 million days are lost through injury or illness in the construction sector. They also think that every year in the UK, there are more than 2,000 major accidents on construction sites that leave workers incapacitated to be able to work in such a way that they can't come back to work. So this demonstrates that as a potential consequence of injury, deadlines can be missed, budgets may increase, but there's also potential of reputational damage or risk to the company. And this might result in challenges securing future contracts, for example. Now, these are just a few examples of some of the potential consequences of injury from the perspective of the employer or the organisation in charge. And there are, of course, many, many more. But if you are finding that you're meeting resistance from construction companies that you're working with about certain aspects of safety promotion on site, for example, you may want to use these and other statistics to build a business case about the potential consequences of injuries for their company and why they should take action to reduce injuries on site. In our experience, approaching discussions in this way about injury can help employers sort of acknowledge the scale of the problem and better understand that managing injury risks not only benefits the construction worker if they can avoid the injury, but it also has the potential to save time, to save money, and it can bring other additional benefits such as a healthier workforce, which can actually increase productivity, and this can improve business credibility. So we briefly touched upon some of the potential consequences of injury to a worker from the employers or the organisation in charge perspectives. But now let's look at consequences from injury from the perspective of the worker. So if, for example, a major injury occurs on a construction site in a low and middle income country, what are some of the potential consequences? Well, this is often the point that Safetyknot that we're asked to come in and help organisations to improve safety on their site. But to do so, we need to build a picture of what's been happening. We need to find out more details about the injury that's occurred. So before we go into site, we ask to see any incident reports or any written information about what's happened. And we find this is a really good starting point. But an incident or an accident report normally tends to tell us what was observed to have happened rather than why it happened. From the report, we may have been able to see what type of work or activity the worker was reported to have been doing at the time. And it may also say about what safety measures were or were not taken. But as I said, it's missing the why. Why was the worker doing the work in the way which they were? Why were those safety measures taken or not taken? So to try to better understand the why, we talked to people. We talked to lots of different people on site to gain different accounts and to try to build an idea of what was happening and also why it was happening from different people's perspectives. Now, you know your community best, and you'll likely know if your community fully understand the risks that they are taking on construction sites, but they choose not to follow safety practices. Perhaps it's due to preference, perhaps it's due to other factors which may or may not be in their control. It may be that they're not aware of what safety practices they should be following. But when we come into support with safety, we're outsiders, and therefore we don't already have this insight, but you do. The good thing, though, about being an outsider is sometimes it means that we might ask different questions or take different approaches to the situation, which means that we can glean a different understanding of what's happening. So, what I would like to do is share a training exercise that we conduct that you may find helpful as a tool to opening up discussion with your community that you already know well, but this might enable you to gain some different insights about why workers are doing what they're doing. So whilst talking to workers, we've collected a lot of case studies during the research we've conducted, and we anonymise these and we use them as part of our safety training. We find that case studies are a very helpful tool for workers to discuss about why they thought those decisions were being made, whether other decisions or actions could have been taken, their thoughts about levels of risk of activities, potential consequences if an injury were to occur, and much, much more. So we found this training exercise to be a very useful tool, one which enables a safe space for workers to discuss about site safety. So this exercise enables workers to identify areas where perhaps they can make changes to reduce the risk of injury, but also, really importantly, where they're not able to make changes themselves, as this is out of their control. They can also acknowledge and identify areas where they were aware of risk attached to the activity, but where they feel that in these situations, actually it's only their employer that can implement measures to reduce the risk of injury, not themselves. Or there may be other reasons why they did make the decisions they did. So I'm going to share one of our case studies, and this is the story of Nam's injury. Nam was breaking rock with a pickaxe on the construction site. He wasn't wearing any eye protection because the goggles he had been given were broken. He had actually asked for a replacement, but he was told that there weren't any more. But to be honest, Nam wasn't that bothered because he found that they magnified things in a strange way, and they also steamed up. So he felt he wasn't able to do his job properly when he wore them, and they also made him feel uneasy. And also, he hadn't been given any training on them anyway. So even before they were broken, he hadn't really liked wearing them anyway. While Nam was working, suddenly a small shard of rock broke off and went into his left eye. It was extremely painful, and Nam stopped working. He didn't know what to do. No one on the construction site was medically trained. There were no first aiders. And anyway, there wasn't a first aid kit on site, as it was in the construction manager's house for safekeeping. So one of Nam's friends came over to him to try to help. He looked into his eye to see if he could see anything that was in it, but he couldn't. So Nam stopped working, went home because it was really painful, and actually his eye had closed up. No one asked him to report his injury. Now, what we do is after sharing this part of the construction case study with workers, a discussion normally ensues, and the common points raised by workers are that no training on correct use of the safety goggles appears to have been given, no replacement PPE was provided, that Nam didn't actually like wearing the goggles because they weren't comfortable, there were no first aiders on site, there was no access to a first aid kit anyway, and there weren't any emergency protocols or procedures in place, and there didn't seem to be any reporting mechanisms in place. After this discussion comes to a natural close, we share the rest of the case study about Nam. The next day, Nam's eye was still really painful and he couldn't see out of it. So Nam travelled to hospital as there were no health posts nearby. The doctor took out the shard of rock which had been lodged at the back of his eye, then said he would need to come back again for more treatment. Nam continued to go back and forth to the hospital many times, and he had to pay for a lot of treatment and also transport. And he found this to be very expensive. He didn't have any insurance, and his employer didn't have any insurance for him, so he had to pay for it himself. To do so, he had to take out a loan to pay for his treatment, and the interest rate on his payments were very, very high. Nam can no longer see out of his left eye, and as a result, he's finding it very difficult to get a job. He's becoming increasingly worried about how he will pay for his medical bills and also how he's actually going to care for his family. Since this incident, Nam spends more time at home and he's starting to get really frustrated. He's also started to drink a lot more alcohol and he often gets very angry. And sadly, since Nam's injury, he and his wife have started to argue a lot more, and sometimes these arguments actually get violent. But Nam's just really worried that he's not going to have enough money to look after his family, and so he and his wife have been discussing about the option of sending their eldest daughter to the work site and asking her to drop out of school so she can financially contribute to the household. Now, at this point, workers' discussion then tends to turn to the pain Nam's in, the time taken to travel for treatment, the cost of treatment, that Nam didn't have any insurance, so he had to pay for all of this himself, that the interest rate repayments are high, and that he's now blind in one eye. And that also he can't get a job, so he must be really worried, concerned, frustrated, depressed, and angry. Now, in our experience, using these kind of personable case studies tends to open up discussions amongst workers. And often if it's not their own stories, but they see likenesses, they're able to draw parallels. So this promotes good dialogue about injuries that have been happening on sites, and workers share their own perspectives of why they think that the injuries that are happening on their sites are happening, what the challenges and barriers are that they're encountering, and also their ideas to potential changes that could be made to make the site safer. So I hope that you found this video useful and that we've been able to share some insight with you about starting discussion about the consequences of injury from the perspective of the employer, but also from the construction worker.